Dr. Ian.
Okay,
hello.
Dr.
Nice
Ian
to see
next to
you.
me. I need to see Dr. Chin. Where is he?
His name is Kin Ning's iPad. Just hold on, yeah. Let me check again.
Yeah,
yes.
Kin Ning's iPad. Can we move him up to the front?
As soon as we can find his name. At the same time, welcome to all of you who are here today. Let's see all of you. Just give us a few minutes and we'll be starting already. The reason why we are going through this is because of your overwhelming support. So we just need a few more minutes and our doctors are here. We have Dr. Peter, Dr. Ian, and also Dr. Chin. And so do send any questions you have into the group as we wait for the session to start. Thank you so much for your support.
Good. Looks like we have a lot of questions, ladies and gentlemen. A lot to get through this afternoon. Okay. Is Vincent here?
Wait.
Okay. Dr. Chin, okay, we can hear you now.
Couldn't unmute.
We can hear you now, Dr. Chin.
Can you say something, Dr. Chin?
Wait, just maybe stand low. Oh,
Can you hear me? Can you hear me? Unmute.
Yes,
I'm still yet to unmute. Cannot touch the button. Or
I can hear you. I can hear you.
The host would like you to unmute. Can you hear me?
Yes.
Can you hear me?
Yes.
hello.
Okay. I'm Dr. Chin here.
Okay, sure.
Okay.
Thanks.
Okay, thanks a lot, John.
Hi, Dr. Peter.
Dr.
I think
Chin's
we can
voice.
start already.
Okay. Have the rest
Yes,
got the
Dr.
YouTube
Ian,
link?
how are you?
John, have you sent out the YouTube link or not?
Yes, I have. I'm sending it again here. And so thanks so much for those of you who just joined. This is FBC's COVID survivor guide that we're doing over here. At the same time, I'm going to be giving you a link for those of you who are from FBC. You can just click this link to watch from YouTube. It would be very helpful because we have a lot of friends from outside the church that are trying to join in. So if you're from FBC, great if you can just click the link and join from YouTube and leave the Zoom instead so that the rest can join. Thank you so much. Yeah, thank you. So Dr. Peter, over to you.
Okay, all right. Good afternoon. Thank you very much for coming out there for this other pandemic, which is basically 8,000 new cases a day and also almost triple-digit death. The reason why we want to hold this seminar is basically to try to get some information out there because there are a lot of people who are confused what vaccine to take, which vaccine is good, what are the side effects. So we'll go through all that. With me, the panelist today is basically Dr. Ian Peng, who is basically a pediatrician with the Sunway Hospital Group. He will be an expert, especially the children's side and younger folk, and he's also very knowledgeable in COVID. Then we've got my good friend, Dr. Chin, who is a general practitioner who's basically frontline. He deals with COVID people every single day. So without much further ado, we've got a lot of questions that are there. I think we can just spend the time. We're not going to bore you with any basically lectures, but basically address the concerns that you actually have. So we're going to look at all the questions that you have. Okay. First thing to talk about, I mean, there's so many questions. I think we've got hundreds of questions. Let me just get through the first question here. I'm going to ask, okay, hang on. All right, ask Dr. Ian Peng, what is the best vaccine that can overcome the variants? Ian?
Okay. Are you talking about the new Delta Indian variant or the last year's vaccine?
Any variant. There's so many. I think there are 10 variants already. If it's Delta, it's 10 already, or Kappa.
Yeah, I think so far it is said that for the general public of health, any vaccine will be fine. But for healthcare, in our medical center, for doctors who treat COVID patients, it is still Pfizer. There's a few reasons for that. Number one, Pfizer is more efficient in preventing coronavirus. In both the Pfizer's data as well as countries like Israel, it's shown that Pfizer can prevent 90% to 95%. Number two, if you have coronavirus after taking 2 Pfizer vaccine, your viral load is still lesser compared to other vaccines. But bear in mind, there's a bit of vaccine variances in different countries. But currently, Pfizer is still a top priority for medical frontlines who treat COVID patients. What about Dr. Chin? What do you think about it?
The answer is same. All the vaccine do protect you, even with the variant. It will protect you minimum 50 to 60%, except for Sinovac, because Sinovac did not come out with very good data regarding the variants. For Sinovac, we are still a bit on the silent, so we cannot swear for sure Sinovac will protect you. But in terms of adenovirus vector and mRNA vaccines, they are good, minimum 60% to cover your variant.
Okay, I think you better check Dr. Chin's audio. It's breaking up. Okay, now I think that question is actually quite moot, because in Malaysia you have no chance of choosing your vaccine, unfortunately. All right, you might get a chance to choose your vaccine next year. So, all right, so next year when the booster dose comes, then you can probably choose whatever. At present moment, if there's a vaccine shortage supply, you can't basically choose. So you have to take whatever vaccine the government gives you. Someone asked, you know, they've got this pulse oximeter. People are rushing to the pharmacy to buy pulse oximeter, costing you 200, 300 ringgit. Unless you have an iPhone watch that has an automatic oximeter. How useful is that, Dr. Chin?
Yes, the pulse oximeter, you must buy it before you get COVID and test it on yourself, because there is a variety of oximeter giving different readings. I myself, I have bought 2 oximeters of different prices. One is a 30 ringgit, the other one is a 70 ringgit. Both of them give me different results. So the way to go about with the oximeter, you have to buy before you get the oximeter. Test it on yourself first and get the baseline. The baseline usually is the range is between 95% to 100%. The first oximeter, which is a more expensive oximeter I got, it only gave me a reading of 95. So how am I going to interpret the result if I get COVID-19? If it dropped by more than 3% of your normal baseline value, you have to go to the hospital. This is my advice. But the guidelines say anything below 95%, you are supposed to go to the hospital. So this is what I can help you in understanding how to use our meter.
Dr. Chin, I think you want to do your
the other way of using.
Can you hear me? Dr. Chin, can you lower the sensitivity of your mic? If your mic sensitivity is too high, then it will break up. I cannot hear you well. Okay. While Dr. Chin, can you say something again to see whether it's better?
The volume of my mic, yeah? Okay.
Yes.
I will lower down my mic.
Cannot hear.
Is it okay? Am I speaking okay? Can you? Is it still
I think it may be your internet connection no good lah.
Can you hear me?
Hello?
Can you hear me?
Yeah, now better.
I will go to another room and see how.
Yeah. Can you do that?
I will go to another room and see how.
All right.
Now better.
Now better.
Okay, I will stay here then.
Okay, so let's have another question coming up.
Now is it better?
Yes. Now better.
Dr.
Yeah,
Peter, do you mind if I show a slide? The reason.
Yes. Okay. Ian, show the slide, please.
Can you show the slides on the treatment? The reason why is that we have actually 5 category of COVID patient. It's on the slides on treatment. Slide number 11. No, the original one. Sorry, not this one. I sent to you one.
That's all I have, Dr. Ian. Can you send me another one? I can get it out for you now.
Okay. Later I sent to you all. There is actually 5 category of COVID patient. The first is asymptomatic, where they are positive but no symptom. The second one is mild, they have only fever, cough, or other mild sicknesses, but no signs of any respiratory illnesses. The category 3 is the one that have saturation more than 94% with signs of lower respiratory tract disease, but they are still stable. The one that is category 4 is saturation of less than 94% or with respiratory rate of more than 30, which in normal adults is 12 breaths per minute. So the reason why we do saturation is that we want to categorize between patients who are moderate class 3 to class 4. And the reason is that anyone who is less than 94%, we give oxygen. That is the reason why we ask people to monitor saturation in patients. So because sometimes they can be from category 3 and they deteriorate to category 4. So there's a reason why people use it saturation in the hospital. But I think there are many people trying to treat at home. So that's why they are buying home saturation monitor. I like to pinpoint that saturation monitor in hospital and in home base, there are 2 very different QC control. So of course, hospital is much more accurate compared to the home base. But home base is quite safe for mild or asymptomatic patient, but definitely not used for more critical patient.
All right, good. Now let's go to another question. Somebody asked, people discharged from hospital after COVID-19, it appears to have increased rates of organ damage. Is that true? Thank you. And Dr. Chin answered, Dr. Ian, you answered that because you're involved in hospital practice.
Okay, yeah.
Or Dr. Chin, yep. Okay, Ken.
Now, it depends on how serious or how severe your COVID was when you're in hospital. The more serious you are, especially with ICU care, with ventilator, I would say that you will have organ damage. And the degree of organ damage also depends on your baseline medical health. So it's very hard for us to pinpoint that whether you will have it or do not have it. It depends on your discharge. Whether on discharge you have organ damage or not, that will continue after hospitalization.
All right. So, okay, next question coming up, please, is question that's always been asked. I'm on blood thinners. Plavix or aspirin or warfarin on heart disease. Can I take AZ? Ian?
I think I like Dr. Chin answer because cardiovascular disease is more common in adults. Okay. Yeah.
Okay, Dr. Chin.
Okay. Okay, when you're on blood thinner or anticoagulant, you are allowed to have the vaccine. Provided you only take notice when you are on anticoagulant. If you are on anticoagulant, your prothrombin time is important, and the INR is very important. It should not be more than 4. If it's more than 4, you have to consult your cardiologist to verify whether you are suitable for vaccination or not. After having said that, when you are on antiplatelet or anticoagulant, you cannot take it off for vaccination. Because especially with anticoagulant, if you take it off during vaccination, you may get a stroke. That is a danger. Do not take it off for your vaccine.
Okay. So let me summarize. Bottom line, if you're well controlled, you're on your Plavix or your aspirin, or even if you're warfarin, if your INR is well controlled, you can still go for your vaccination. Because if you stop your warfarin, for example, you're going to get into trouble with blood clots. Now, this is a question to basically Dr. Ian, because in the last 1 week, there's some data from Pfizer saying there's myocarditis or inflammation of the heart linked to the Pfizer vaccine. Can you comment?
Okay, this one I'm going to leave to Dr. Chin as well, because in children, it's very different pathology as well. But maybe Dr. Chin can explain it a bit more first.
Okay, for myocarditis, in the normal setting without COVID-19 or mRNA vaccines, they have found that the incidence of myocarditis in the general population is between 10 to 20 per 100,000 people. But what we saw in the messenger RNA group of vaccine patients, the incidence rate is only 1 in 50,000. Yes, there are cases of myocarditis, but the myocarditis in young individuals is way below the normal occurrence of myocarditis in the worldwide. Now, and what they have found out, all these things were found out and highlighted in Israel. They found out that most of these young people who got myocarditis are 95% are very mild and they recover by themselves. Only 5% of them actually need some anti-inflammatory or corticosteroid to get them well. So they are monitoring it, looking into it, but it's no cause for alarm yet.
Yeah. Okay. Good. So that was only a report of last week. Okay, and it's about 100 over cases in Israel. It seems to be linked, but the jury is still out. Okay. Now, what about cancer patients undergoing immunotherapy? Is it advisable to go for vaccination?
Okay. The advice is that before you go for surgery or chemotherapy, get a vaccine first. If ever after your surgery or especially with chemotherapy, you should be 3 months after chemotherapy. Immunotherapy longer, 6 to 8 months before you can get the vaccine. Otherwise, your vaccine will not be useful.
Okay. All right. Now, Dr. Ian, is there any particular reason why children or teenagers are not so likely to get severe COVID?
All right. Okay. They are not so. Okay. The previous COVID variants, children don't get COVID so easily. That's number one. All right. But anyone still can get COVID. Just that the incidence rate is lower. I'd like to show some slides. Which is slides number 4. All right. You can see there's actually a large cohort study done in China, where there 44,000 people. You can see the symptoms are mild to moderate in adults in 81%, severe is 40%, critical is 5%, and the case fatality ratio is 2.3. And you can see that the median time of experiencing breathlessness was 5 to 8 days, and the median time to develop quite a serious acute respiratory distress syndrome was 8 to 12 days, and the median time to ICU was 9 to 12 days. And this study itself, it also showed in children that the illnesses of children is less, it's 94%, and the severity is only 5%, and critical was actually less than 1%. The reason behind this pathology is that the children has different ACE enzymes in the lungs. What it means that there's less angiotensin converting enzymes in the lung. What does the problem that COVID does is that COVID overreacts with the ACE inhibitors ACE enzymes in the lung, causing a lot of lung damage. This is less than in children. Can you show slides number 4? Slide number 4, please.
Hi, Dr. Ian, are you needing me to show any other slides?
Slide 4. It shows about cohort study. This is slide 11, slide 4. So these are the studies. You can full screen. You can see that this is a proper cohort study in China. So again, to repeat, there are actually more severity symptoms in adults, and in children itself is much more less and less critical. This is a very large number of a cohort study. So the reason is, again, ACE enzymes in the lungs is less than children, leading to less severity. All right. Okay.
Okay. Thank you very much. Now I'll just take some of the questions simply because I think Dr. Chin's audio is very bad. So some of the questions which I can answer, I will answer also. Okay. Now someone asked, thank you for organizing this Zoom. I must ask, can the AZ vaccine wait exactly 3 months to get the second dose? What will happen if the second dose taken less than 3 months, say in 2 months? Appreciate your response. The answer is it doesn't really matter. Originally, when AZ came out from Oxford, they were supposed to inject it after about 3 weeks. But because the British government took a bit of a gamble and said, we want to get the first dose to as many people as possible, they stretched the 3 months against doctors' advice. And actually, it turned out that it provided enough immunity. So it doesn't matter whether it's 3 months or 2 months. Don't worry about it. Okay? So not so a bit of a problem. Okay. What medications to take if one gets COVID and want to self-quarantine at home? Why don't we ask someone who actually treats people with this? Dr. Chin, can you answer this? What medication do I take if I get COVID and I want to self-quarantine at home?
Yeah. Okay. Usually we allow you to be self-quarantine at home or when you are stage 1, stage 2 until stage 3. Okay, we allow you to stay at home. Okay. Now, the moment you have a pneumonia, you are supposed to go to hospital. So when you're staying at home, you only take symptomatic treatment. You got fever, you take fever. You got cold, you take some cold and take cold tablets, and drink plenty of water and rest. And look out for warning sign. The moment you have warning sign, you are supposed to get yourself admitted to hospital.
I think there's a slide to show symptom. I think it would be good that we go by
now,
symptom, by test. That would be a good way to make it more a proper flow. Yeah. I think or else it's gonna be a bit jumpy left and right. So yeah.
Ian,
which slide is it, Dr. Ian?
Slide 2. So Dr. Chin mentioned about the serious
the
symptoms.
slides on the test. The test.
Yeah, sorry, that is like, okay, I think this is what Dr. Chin said. If you have serious symptoms like shortness of breath, loss of speech or mobility or chest pain, I think that's a very, very serious red flags. Or in children, it's called dehydration. If they're very dehydrated, they're lethargic, they refuse to drink, or very high fever, then it'll be good to see a doctor immediately.
Ian, can you walk us through some of the tests?
Okay, the next slide. All right. Okay, it's known that for the incubation period of COVID-19, the virus stays in the body for 14 days. And the median time of the symptoms after exposure is 4 to 5 days. Meaning that if I were to get COVID today, it's very likely in 4 to 5 days, I'll get the symptoms. And one study has showed that 97.5% with COVID patients develop symptoms within 11 to 12 days. So it's not common to develop symptoms after 14 days, but you still can have, but very low. The studies have shown that reinfection is possible, but how does it happen is unclear. We have no idea or no data how long people will recover, are protected against a reinfection, as well as also how much concentration of antibodies of COVID-19 have been correlated. So we do not know how many antibodies is enough to prevent a reinfection of COVID. All right, next slide. Next slide. Okay, I went through that. Next slide. So again, based on the cohort study of 44,000 people in China, age is the strongest risk factor for illnesses, complication, and death. in the China data itself, if you're more than 80 years old and you get COVID, it's very likely that 14.8% of mortality, which means death. And it's lower when you are younger. And this is also very true for the US data, very similar to China data. Again, for 85 years old, the mortality rate is around 10 to 27. And also they did a further data as well that the main comorbids of why people die is because the primary reason is that they have cardiovascular disease, meaning of heart disease, followed by diabetes, respiratory, and cancer. So the reason is, to speak on my personal experience, my father had a triple heart disease, very, very bad. Both of his 3 main coronary arteries were blocked. 2 were fully 100% blocked, and he needed to do surgery. So because of that, for the high risk of 10.5, we decided that the COVID vaccine is much more important than not taking the COVID vaccine. That's the reason why we stress that people who have cardiovascular disease to take the vaccine. Although there is a risk, but the risk is very, very low for the COVID vaccine compared to dying from COVID-19 infection. Okay, the next slide. Okay, so I think in KKM and even in CDC guidelines, they say that for most adults, isolation and precaution can be discontinued after 10 days of the symptom, or at least after resolution of 24 hours and quarantine for 10 days, you're probably quite safe. For adults with no symptoms and incidentally COVID positive, you can stop isolation for 10 days. But the data itself shows that if some people are very immunocompromised, they are very, very sick with COVID-19, somehow they still can remain infectious up to 20 days of the symptoms that begin, and they require further additional COVID testing. This is something very controversial. That's why initially they said, people say that the virus in the body can stay for 14 days incubation. Why is it now they say 10 days? I think there's a lot of data saying that people are unlikely to be infectious after 10 days if you are healthy, but if you're very seriously sick with COVID, it can be up to 20 days. So that's the reason why there is a lot of confusion and sometimes a lot of disagreement of how the hospital quarantine should isolate 10 days to 14 days. So certain hospitals, certain countries isolate different timing because of these 2 different data. But in Malaysia and in CDC, they say if you're very well, you quarantine after 10 days, you're unlikely not infectious. But it's not 100% because I can see that if there are patients who are very sick for a very long period of time, the virus can still maintain in the body beyond 20 days. And I think there was also a data saying that actually you can get multi-system inflammatory syndrome if it's in COVID patient. You can get also inflammation of the heart, carditis, inflammation of the brain, and encephalitis. And in children, we see something called Kawasaki. We don't label it as Kawasaki, we label it as multi-system inflammatory syndrome, but it is the treatment similar to Kawasaki. All right. Okay, I'm going to pause. Is there any questions for symptoms to Dr. Chin or Dr. Peter? You can stop the slide now.
Now the summary for not being infectious when you have COVID-19, the summary is between 8 to 10 days. Your virus infectivity will decrease. But I usually keep it until 14 days because it's very difficult to know when is the first symptoms of a patient. So I keep it for 14 days. Like Dr. Ian has mentioned, that the immunocompromised patient, we have to keep it for longer. So for my practical point of view, those who are hospitalized, I will ask them, have they been admitted to ICU? If they have been admitted to ICU, I will keep their quarantine period a bit longer just to play safe. So that is what I do.
Yeah, it makes sense. The guideline says if you're very sick in the ICU, definitely at least 20 days would be much safer.
Okay. What's happening is that we actually have somebody who suffered from COVID recently to give some testimony. Is Corinne Au around?
Yeah, I'm just here.
Is Corinne? Ah, yes. So let me just introduce you to everybody. Corinne is a member of our church, and so is Vincent is also there in his car. Both of them have had COVID recently. Corinne, Vincent is not quite so bad. AB, you want to share? We'll start off with the milder case, and then we go to the more severe case. All right, we'll start off with Vincent. Can you share with us what happened to you, Mr. Vincent Yee?
Yes, I'm in, Dr. Peter. In.
Wait. Is Vincent here? Vincent, can you say something?
Oh yeah, yes. I'm here.
Okay, never.
I'm here.
Can you share your experience?
Oh yes. Okay. Okay.
Vincent, go ahead.
Okay. Thank you. First of all, I would like to thank Dr. Peter Ng. He tried to help me to get the private hospital. By the time the private hospital are all full, so I have no choice but to call the Sungai Buloh Hospital and the 911. But it takes about 10 hours, you know. So dear brother and sister, those who are above 60, please stay at home, stay safe. You know why? You might not be as lucky as me, you know. So I am running short of breath, running short of oxygen for almost more than 15 hours. But lucky that mine is very mild one. So after calling the 911, we keep on calling. At the end, the ambulance came, and the ambulance took me to the Sungai Buloh Hospital, and I was admitted to the Sungai Hospital. They have divided into zone, you know. I was admitted to the yellow zone. I spent about 1.5 day in the yellow zone, and doctor will took my blood 4 times and X-ray me and test my temperature, my heartbeat, everything. And 1.5 hour, after 1.5 days, the doctor and the nurses will decide. Those with a severe one, they will send to a red zone. Red zone means they are severe cases. They have heart problem, lung problem, liver problem, and all kind of problem. But I was lucky because I don't have sore throat. I don't have a fever. I don't have cough. But I'm only running short of breath. So they transfer me into a green zone. Green zone is all the people that they have no cough, nothing, and only thing is that running short of oxygen. So in green zone, doctor and the nurses try to take off my oxygen tube. Try to take off for 5 hours, but after that, they're forced to put it back because my oxygen level is below 50. First time. Second time try also, they took off for about 5 to 6 hours. My oxygen level also below 60. So I got to put it back. So after 2 days in this green zone, then they transfer me to a special zone, especially only for lungs, you know. So there they give me special treatment, and after that they took off my oxygen tube, and praise the Lord, I was able to maintain my oxygen level, my lung and my blood above 95, and after that they sent me home because you know why? They need places, you know, people are coming in. So this is my sharing in the hospital.
Okay. All right. Thank you, Vincent. Just to remind all of you, private hospital beds, today it is almost impossible. All right. So very few beds have only allowed a certain number in the ICU and the ward. So it's very, very, very difficult. So actually go to the hospital I managed to get is Corinne. She was in ICU for some time. Can you share with us your experience?
Okay, yeah. I was tested positive on April the 25th. Okay, I delay going to hospital. Okay, and I didn't report to KKM. Okay, it's because I told myself if I were to report to KKM, they might put me into a government hospital, which I do not want. I want to go to a private hospital. Anyway, I stay at home, monitor myself. Yeah, I have this oximeter, the small oximeter. I measure myself. I have a thermometer. I also measure myself. But unfortunately, my fever keep having fever, despite of taking Panadols. Until like 1st of May, after a few days, I consulted our own church doctor, that is Dr. Lee. Okay, Dr. Lee was very kind. Even on the Labor Day, 1st of May, he video called me, he assessed me, and he prescribed some nasal spray, Panadol, and I think cough mixture. I don't recall. So I was taking it like for Saturday and Sunday. It didn't work. Okay, and so come Monday. Okay, Monday, there is like about a week already. I quickly call, because I was really suffering. I quickly call our Dr. Peter. I said, Dr. Peter, I know everywhere ICU beds are all full, okay? But I need to go get into the hospital because I'm having difficulty in breathing. My oxygen level is quite low. And Dr. Peter managed to get me a bed, okay, at the SJMC, and I quickly went in. The doctor assessed me. He got a doctor for me, which is a very experienced doctor, Dr. Ronald. He said I need to be in the ICU. Okay, I went in for a couple of days, and we tried to save costs, and also because they are more serious patients. Okay, and so I was put into a ward. Something happened in the ward. I don't want to point finger or anything like that. Something happened while I was in the toilet, with the portable oxygen tank. The oxygen tank went empty. Okay, I panicked because I have the oxygen mask on. I really panicked. For full 10 minutes, I tried to call the nurse and I yelled for them. Eventually they came in after 10 minutes. I really panicked at that time. And then again, my condition deteriorated. Okay, doctor came and he said, I need to go back into the ICU. Okay, and then they pushed me back into the ICU. Doctor assessed me, actually quite bad. Say, my lungs are, not clear. The X-ray show a lot of shadow. So Dr. Ronald said to give me a heavier steroid. Okay, and he told me also it's very costly. I think it's 6,000 to 7,000 a dose. I only need one dose. So I told him, yeah, please just give it to me. And he gave it to me. And I thought that's it, I'll recover straight away. But actually, no. The recovery, I tell you, it took a long, long, long time. And so after the jab, the doctor assessed me again. He said, I need to be on the heaviest oxygen mask, okay, with the highest level of oxygen. So he said to try this. If it doesn't work, then, I have to be intubated, which I try to avoid. As you all know, once I'm on the with this ventilator, you all know that, the chances of surviving is only 50%. Okay, because they will put you into coma, induced coma. The chances is only 50. I don't want to go into that stage. So as a Christian, I keep praying and praying. I've got nothing to lose already. Who can help me other than our Lord? So I pray and I pray and I pray. And my pastor sent me Bible verses. I cannot really read already at that time. I put it on the audio and I keep on playing, and I have my laptop open. I keep on playing the worship song. All this helped tremendously. Okay, I have full trust in our Lord. Yeah, for 2 nights, I was really touch and go in 2 nights. For that 2 nights, I really pray very hard. Okay, eventually, my condition is getting better and better and better. Yeah, it is no joke, Even though when I've discharged from the hospital now, like 3 weeks already, I still having all the side effects. You see my face very puffy. Yeah, I'm not so round before it's because of all the steroids in me. And I still, when I walk, I'm still not that steady, I'm very wobbly, And this morning, I have an appointment to do my vaccine. Okay, it's actually at the PWTC. My son took me there. But when the doctor asked me question, I cannot tell lies. I have to tell them the truth that I was COVID-19 survivor. And he asked me when was it, when the test came positive. I said April 25th. It's like I take it. He said no. Rules is rules. He said we have to wait for 90 days. Okay, and so now my vaccine is postponed to July 25th, which is good lah. At least I have the date lah. I don't have to try the MySejahtera again and try to fight for a slot. I don't have to do that anymore. It's given to me already, the slot. Okay.
Okay.
So, and when I am home, when I walk outside, I still see people, couples carrying babies without mask on. I would tell them, I don't know whether they like it or not. I said, excuse me, the virus is in the community. At least get your child protected lah. If not, just stay at home. They are not wearing masks at all. I've been telling at least three couples already walking with the babies. Yeah. Please stay at home if you have nothing to, any reason for you to go out. Please protect yourself. Just now I have double mask, surgical mask, and on top of that a cloth mask and a shield also. Yeah, to protect myself. It's no joke, this COVID-19. It is really out to kill us. I really suffer. Until now, I still having the side effects. Okay, that's my sharing. Thank you.
Okay, thank you very much, Korean.
From Brother Vincent's, from what we can learn from Brother Vincent's case, he did not have much symptoms until the 7th day. So it shows us that for older age group, our severity of the COVID-19 can develop after 7 days, 8 days, 12 days. So don't be too happy if any one of you get COVID and start moving around, socializing before the 14 days. You have to quarantine yourself for 14 days. The thing we can learn from Corinne, don't ignore COVID-19. Don't take it too lightly. Know your warning sign. She has delayed herself quite a fair bit of time before she get admitted to hospital. So the important warning sign that we have to watch out for is breathlessness, chest pain, difficulty in mobility, that is said you cannot get out from bed. You have problem walking on flat ground, that you become breathless. When you're walking up steps, your normal staircase, you're breathless, and you are unable to eat well. Those are the warning signs that you should go to hospital. Don't ignore it. Otherwise, you will end up in ICU most of the time. Because with early intervention of symptoms, you can really reverse your disease from stage 3 to stage 2. So it's important to know your warning sign and register yourself with MySejahtera, because they will give you a flow chart to take all your symptoms daily and do it diligently. Whatever you don't understand, call up your GP to verify. That is important.
Hi, Dr. Peter. I have some list of questions over here. Shall I show it on the screen?
Yes, please.
Okay, hold on, yeah. So for everyone's benefit, we have already given access a link that's been sent by our friends earlier. If any questions, you can just post it into the link given to you, and then you can even vote for the ones that you like so that the panelists can take a look and also give their inputs on it. So over to you, Dr. Peter.
Okay, let's go through quickly. All right, let's take the first one, diarrhea, sore throat, via Google. Wow, that's great. Similar symptoms to COVID-19. At which point of time should I? Can you quickly answer that one? Dr. Chin.
Okay, now if you have symptoms with the sore throat persist for more than 2 days, go and get a test done at this point of time, because now is a super red zone for a lot of places. The infectious rate is very, very high, and the chances of you getting COVID is very high. Get it tested. If you have sore throat, cough, or runny nose for more than 2 days, get it done.
Next one, is it safe for a person with a high resting rate of 85 heart rate to take AZ? Does the vaccine increase the heart rate? No, take a rate of 85, no problem there. Next one, I'm taking Crestor 10 mg for cholesterol and already slotted for AZ. Is it okay? Please go for it. In Crestor, that will stop you from taking the AZ vaccine. Okay, now the next one. I had AZ on the 28th of May. On the 2nd of June, I had subconjunctival hemorrhage in my right eye. Will the second jab affect having blood clot and stroke? That's very difficult. I don't think so, but let's ask Dr. Chin.
The thing is that when you have subconjunctival hemorrhage, do you have a blood pressure problem? If you do not have a blood pressure problem, the chances of you having a blood clot or whatever is very low. Usually it occurs after the second dose, not the first dose, the blood clot phenomena.
So at the same time, if I hold my breath for 30 seconds, can this be a good indicator that regulate my lung? My lung is well.
Yes, good.
Dr. Chin.
Yes, you can do that.
Good.
You can do that to know yourself, whether your lungs capacity is good or not. You can do that.
Very good. Next question. Why are older people less vaccine side effects?
Okay, I'm going to explain this. Yeah. This one is a strong data. The older people has less vaccine side effects compared to younger because of two reasons, which I mentioned. Vaccine actually stimulates the antibody, which is actually your immunity. So younger women has the highest response to vaccine. The older you are, the less response. Men has less response than women. That's why if you see AZ, the highest complication are actually young women.
Okay. So my mom was hospitalized twice due to chemical issues. I don't know. Is it chemotherapy issue? She's also a cancer patient. Can she take the vaccine? Dr. Ian?
No, if you're on immunotherapy or on cancer treatment, on concurrent treatment, there is no evidence to say you must take the vaccine because it can be harmful. Normally, if you're on severe immunosuppression like high dose steroids or chemotherapy, no doctors will advise you to take the vaccine. But there is different stages of chemotherapy. Bear in mind, this question is not specific. They actually got intensive phase of chemotherapy. There is a maintenance phase of therapy. So definitely in intensive phase of chemotherapy, you cannot take the vaccine. But maintenance phase of therapy like oral tablets for 1-2 years, to control the chemotherapy, you have to ask your oncologist because it depends on the ANC or the white cell count as well. Next question.
Okay, next question. If a patient stays at home, this is for Dr. Chin, home treatment, any medication take, let's deal with the question of ivermectin and what dosage to buy.
Okay, start off with asymptomatic. If you are asymptomatic, no treatment, just sleep and drink and eat well, finish. If you are symptomatic, if you are in stage 2 with no pneumonia, but have cough, running nose, just go and get some cough syrup, some running nose medicine, and some fever medicine is good enough. And look out for warning signs like what I've said: breathlessness, chest pain, difficulty in getting out from bed. Your appetite drops tremendously. Be careful with those warning signs and get yourself admitted to hospital when you get those warning signs. Now, as regard to prophylaxis ivermectin,
Okay.
we are actually waiting for a green light from our DG, but so far no. So as far as a Malaysian practicing doctor, when there's no green light from the Ministry of Health, we should not be using it unless we get green light from them.
Yeah, okay, it's very important because we don't even know what dosage of ivermectin is useful. There's low, some high dose, and there's very few randomized controlled trials. So let's not trick ourselves. Now, next question will be, I'm allergic to Panadol. Dr. Chin, what vaccination is suitable?
You are allergic to Panadol, provided you don't have swelling of face, difficulty in breathing, need admission to hospital to treat your allergy to Panadol, you are okay to take the vaccine of any types. Just that keep some antihistamine at home. In case you've got mild rashes, you take those antihistamines. You can go for this vaccination.
Very good. All right, next one. Can adult with beta thalassemia carrier take the vaccine? I'll answer that. It's quite easy. No problem. Continue to take it. Question, I have an aunt who's 81, a survivor of COVID. When do you think she's able to take her vaccine? According to some doctors, a month, others says 3. That's a good question. We just was rejected from doing her vaccination because she just had her severe COVID in April. They told her to come back 1 month later on. Is that right, Corinne?
Yes. The answer
okay. So
is between 3 months to 6 months. You can wait until 6 months. It's no problem because you still have the bodies in your body to protect you from the COVID-19, but not the variant, but by the COVID-19.
Okay. Now, Dr. Ian better answer this. How much antibodies or protection after first dose is right?
Okay, there's actually no proper data, but there is some data from countries who have taken Pfizer, like Israel. First vaccine is enough to protect you from severity of dying already. 1 dose is enough already, but you need 2 doses for maintenance. So how much antibodies, we have no idea. But after taking a first dose of vaccine, it's really starting to work.
Ian, can you comment on does AZ affect a woman's reproductive function?
No, definitely no.
This is related to babies. No?
No. It
doesn't affect, right?
Yeah, you can take
it.
Even so, I put up the slide later on. The exact is safe for breastfeeding mother, as well as Pfizer. But from Sinovac, there's no data. The government has already released these guidelines. For pregnancy, only Pfizer is allowed to be vaccinated for pregnant mother between 14 weeks to 33 weeks or after delivery. But for AZ and for Sinovac, no data. So KKM said do not vaccinate.
Okay. Which is the best vaccine for mitral valve prolapse in hypertension? Dr. Chin.
Any vaccines is suitable, provided you are not on anticoagulants or warfarin.
Okay. What is the best vaccine to be administered for a person with lots of allergies?
Again, it depends on your severity of allergy. As long as you don't have swelling of face, difficulty in breathing, and need admission to hospital, you are okay with any vaccine. Just keep some antihistamine with you. if you are
Yeah.
needing hospital admission and have a difficulty in breathing, then alarm the attending doctor in the center that you have such allergy. Most probably they won't give you the mRNA or adenovirus vaccine, they will give you the Sinovac vaccine. But again say, Sinovac vaccine is not side effect free. It can also give rise to side effect. Bear that in mind.
Yeah. Okay. So the best thing if you've got multiple allergies is to have your vaccination done at a hospital, because hospital will have the backup to be able to resuscitate you should anything happen. If you go to a state or somewhere else, it'll be a bit more dodgy. So be careful about that. Okay. Now, somebody else said, I'm on medication with Myonal milligrams, meloxicam, 7.5. Should I stop before AZ, Dr. Chin?
Not necessary to stop. By the Celebrex, you should stop You should stop the Celebrex and just go for the vaccination. Myonal is okay lah.
Okay, good. Okay, what is Myonal?
It's some kind like a muscle relaxant for their muscle pain.
Okay, all right. Can dogs get COVID and pass to humans? A very common question. Anybody? Dr. Ian,
Yeah.
Dr.
So
Chin?
far, only one case of animal contact. Okay, now so far only one documented case of animal got COVID-19 from human. So far, no documentation. So not to worry. From our practical point of view,
Okay,
not to worry that the human will transmit to animals.
All right. Someone asked, does the person who tests positive with COVID-19 still need to go for vaccination?
Yes.
Dr. Chin, that should answer that.
Yes, yes, after 3 months.
After 3 months. Okay, good. The next
Yes.
one.
Sorry, I like to clarify. It's
Okay.
not the guide has changed. They don't wait for 3 months already. The guide has changed already.
3 months, huh? All right.
No more 3 months.
All right. Now,
Yeah.
okay, we only got a couple of minutes left to go. So what I want to do now is we have a word from our sponsors. They will handle the next few questions. So, Fred, can you put up our alpha video first? Just give us 5 minutes, ladies and gentlemen. Fred?
Life moves fast, doesn't it? Every day there's so much to fit in, but do you ever stop and think, what's the point of it all? Do you ever ask yourself, is there more to life than this? Alpha is a series of sessions exploring life, faith, and meaning. It's a space where you can ask all the big questions, say what you think, and hear about other people's points of view. First, there's video and then discussion. Each video explores a different aspect of the Christian faith, and then in a small group, you get to say exactly what you think. The aim of each video is to spark conversation, each week unpacking a different question. It's an opportunity for you to hear from others and contribute your own perspective in an honest, open, and friendly environment. So why not try it out?
My friend introduced me to Alpha.
I learned about Alpha from my wife, a restaurant owner, which my parents and I have a dinner there. And she's actually kind enough to share the details of the Alpha with us.
When you have question, you can go to Alpha because there a lot of people will come. When you put forth your question, they will clarify your answer. See the same thing in different manner and from different perspective you can see.
I benefited from the Alpha course through growing spiritually and sharing my ideas with other people and basically meeting so many other people.
I'm able to stand up from falling into depression, as I've lost my son not too long ago.
What I learned when I joined Alpha is to ask questions, which can be difficult even for people like me who's grown up in church, but in a safe environment where you can discuss things that you're not sure about or work through your doubts.
Nice game, nice people, so I had a lot of fun also.
Life moves fast, doesn't it? Every day there's so
Okay, thank you very much. So some of you who might be interested in hearing more about the gospel of Jesus Christ through Alpha, please join us. We're starting a new Alpha in July. Contact the church for an opportunity. Now, can we just carry on with a few more questions? John, can we highlight questions? Okay, where were we? COVID airborne droplets. Wait, hang on, where are we? Okay, what about vaccines for children under 18? Dr. Ian?
Yeah, I think it's about safety. Other countries are considering vaccinating teenagers now. They want to wait for safety, and also about vaccine availability. So the main priority is to give the elderly patient, as well as also the frontliners, that they go by younger and younger age group. So once they have completed that, they'll give to the teenagers once the safety approval has been certified. So there are countries like Singapore, like US, that take care of vaccinating children, or mostly teenagers first, then children later on.
Someone wrote, I heard virus more likely to mutate in immunocompromised patients where virus stay or strive. You say 20 days. So to get vaccinated fast, use chances of variants of concern now. So I think basically the question is that does the quick vaccination reduce chance of variants?
Yes, I think
this case
of Vegas is a good question. Yeah, there is a case study that an HIV patient had 5 mutations throughout his COVID infection. So definitely, it's true that the virus mutates more likely in immunocompromised patients. Yeah.
Okay. Since so difficult to get hospital bed and a long time before we get a call back, then isn't the oximeter important for self-monitoring at home? Dr. Chin?
Yes, you can get one, but get one before you get COVID and test it on yourself as a baseline. That is more important because, like I said, different brands give rise to different sensitivity and different readings. That is very alarming because the windows is very narrow. Normal is between 95 to 100. Anything below 94, you have to call the hospital for admission. So you must get it beforehand. It's valid if you know, if it is a good instruments to monitor your oxygen level if you do not get admitted to hospital.
Okay, very good. All right. So remember, please contact the hospital, and basically it's better to call 999 because private hospitals are usually full. We won't handle the question of ivermectin. It's been answered before. Is COVID airborne droplets? And yes, it is spread by airborne droplets. If you cough, you shoot out those droplets at 50 miles per hour. If you sneeze, it's almost 200. So wear your mask. Now the question is that must be the mask, cloth mask after every use, Dr. Chin?
Yes, you have to wash your cloth mask, but the cloth mask is not protective enough. You need to use a three-ply surgical mask, which is more important. And wearing your mask tight fit without any gaps, any holes in over your nose is very important. Because what they have found out, by wearing your surgical mask loosely, it only confers 40 to 50% protection. The moment you wear your surgical mask first, and on top of that, wear cloth mask to press down your surgical mask to be tight fit, it confers about 80 to 90% protection. So bear that in mind, wearing it tight fit is more important than wearing multiple layers.
Okay, now next question. Your slide shows MIS affecting adults and kids. MIS affects which age group most, Dr. Ian?
It's rare. It can affect children also. Actually, younger have MIS.
Okay. With the new variants, do we need an annual jab as per Pfizer CEO's initial suggestion for 2 jabs? Dr. Chin?
Yes, it looks like we need, because the variant is mutating so fast that every year you need a booster. You need a booster jab for different variants. Okay. Definitely, yes.
All right. So, TB patient recovered after 6 months in 7 years ago. Lately, 3 years ago, done bypass on medicine. Since then, can go for vaccine, Dr. Chin?
Yes, you can go for vaccine. Not a problem.
Okay. All right. Catching COVID, Ms. Corinne Au should have immunity to overcome and will not get it again. True or false?
False. You still can get. I've already put up the slide saying that the antibody levels do not correlate to immunity. Yeah.
You still can get COVID-19.
Yeah, you still can get it.
You still can get COVID-19.
Yes, yeah.
Yeah.
It is false that you will not get COVID. You still can get COVID.
Okay. Well, what about do's and don'ts before and after vaccination, Dr. Chin?
Before vaccination, definitely you can get COVID. After vaccination, also you can get COVID. But the only thing, you will be asymptomatic. If you are symptomatic, you will have less symptoms. Your severity will be less. Your hospitalization will be less by 97%. And you won't die from it. That is the advantage of having the vaccine.
I think right there is what you should not do before vaccination. I think you should rest well, do not smoke, do not drink before vaccination. And the CDC do not take any painkillers before vaccination. It's actually in the CDC guidelines. They said it's not recommended that you take any of this over-counter medicine for the purpose of trying to prevent side effects. No. But I do know that people take it, including doctors.
Okay, very good. Okay. All right. So is this person has got asthma? Is it okay to take vaccine AstraZeneca?
Yes, you can take it unless you have severe asthmatic. If you have serious asthmatic, you must inform the doctor at the center.
Yeah, it can trigger an attack, right?
Yes.
All right. Now there's a question on blood clots. Several sites. AZ blood clot more likely after first dose, 4 days till 14 days, less likely till 28 days after vaccination, even more rare after second dose. Oh yeah. So someone comment on the blood clots for AZ, because the questions are a little bit difficult to understand.
Actually, the blood clot occur more frequently after the second dose. That it varies with time. It can be 28 days, it can be 3 weeks, 4 weeks after the second dose. Usually it's after the second dose. Whether it is alarming or not, they are still monitoring it, but they have assessed the benefit outweighs the side effect for the time being. So need not have to worry. And on top of that, the blood clot occur on a younger age group. So people like us above 60, we need not have to worry about the blood clot so much.
Okay, now I think we have come to the end of our session. We never expected more than 500 people joining us this time, but obviously we have tapped into a significant degree of anxiety in the community. So as such, all your questions, we still have that. Okay, we will go through some of the questions which are not answered next week at the same time. If you like, you please subscribe to our FBC channel Facebook for announcements, but it will be exactly the same address at 2 o'clock next week, simply because there's such a great community response to this. And I know you all have questions, and our aim is to answer every single question. And you can still email you can still email to us any questions we have beforehand, so that or post it so that we could then straight away answer your questions the next time, so that the answers will all be personal. All right. So this is the First Baptist Church Facebook, as well as it's a Facebook as well as a YouTube channel. Please subscribe, and we'll see you back here again next week. I want to extend my deepest thanks to our brother Dr. Ian Ping and Dr. Chin, who have really been so helpful doing all this. Now, there is somebody else here. Some of you are sending questions here and sending comments. Like somebody says we should not take vaccines, etc. Please do not listen to that person. Okay, we do not send anti-vaccine data. It's wrong and it's fake news. Do not listen to these people. All right. I'll see you guys next week. Thank you. God bless.
Bye-bye. Take care, everybody.
Bye-bye.